The Cleveland Clinic is out with a survey of what Americans really know about heart health. More than 70% are aware that stress can negatively impact heart health, but 40% recognize that alcohol, tobacco, and lack of sleep can too. So I asked the director of Women's Cardiovascular Center at the Cleveland Clinic about some immediate action steps we can take now.
That's a great question. So the number one thing I will say is incorporate exercise in your daily routine. You know, there is no drug that can possibly give us the benefit of daily exercise.
Dr. Leslie Cho, who's the director of the Cleveland Clinic Women's Cardiovascular Center, says use the stairs, park further away when it's safe. And she also says putting some power into your daily walk to boost the cardiovascular benefit is optimal. Talk with your healthcare provider about your family history and then control your risk factors aggressively. Don't smoke or stop if you already do. And take note that alcohol, she says, can increase blood pressure. Dr. Cho also says choose a Mediterranean or plant-based diet with more fish and chicken and less beef and pork. All of those things can help lower your risk for heart disease. What do you say to people who live perhaps in food deserts or who are struggling financially? How can they apply some of these principles practically?
Yes, I'm so glad you asked that question. It's so important. So one of the easy things that you can do is there are frozen vegetables that are quite cheap, actually. You can buy it in bulk.
Just have to be a little creative there. There's a reminder that cardiovascular disease is the leading cause of death in women. Nearly 45% of women over the age of 20 are living with some form of it. So you want to keep that in mind. And another one that's really stark is that cardiovascular disease is the leading cause of maternal death in the United States. Simply put, heart disease is the #1 killer of new moms. So there's a message there for everybody. It's why we are all wearing our red today to support women's heart health. And Amy and I were talking just briefly this week about just some simple things you can do, because she says exercise is the #1 thing.
And it's just as easy as like walking. I know we were talking about how there's like a trendy treadmill workout right now.
Yes.
The 12, I think it's 12 by 3 by 30, but you can do that like outside at a park. It's so easy.
So that's incline 12.
In 12 incline, 12 incline, 3 speed, 30 minutes.
Yes.
Which is all fine and good, but if you don't have a treadmill, like they said, park a little farther away from the place you're going to. Take the stairs instead of the elevator. There's simple things you can do to get exercise on a regular basis.
And if you have good shoes, just walk up and down the street. Get your heart rate up.
Exactly.
Are you doing the 5K tomorrow?
I am. You
Dylan,
should
That is
join
exercise.
me along with
I thought
thousands
he
of other
was kidding
people.
when he said he was running a 5K
That's great,
in February,
though.
but good for you and
You've
good
done
for
this a
all
few
of
times,
everyone
right?
else read it.
Yep.
Okay, take a note from Dylan here.
Yep. So 3.1 miles. It starts Sunday at 10 a.m. near Nationwide Arena.
All right.
Excellent.
Go, Dylan, go.
All right.